Welcome to Doctors on Call. I'm Jenna Miller. 40 million American adults are affected with anxiety disorders each year. 1 in 20 children were found to have anxiety or depression in a single year. People with depression are 4 times as likely to develop a heart attack than those without the illness. This is one of the many reasons why it's so important for patients to remember that mental health care is health care. On tonight's Doctors on Call, we'll be discussing the importance of getting proper mental health care with our guests, Cary Schwarz and Beth Christianson from High Plains Mental Health Center.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from at Blue Cross Blue Shield of Kansas. We're committed to being a healthcare partner you can turn to. That's why we're simplifying the health insurance experience so you can feel more empowered in your health.
Russell Regional Hospital, experts, neighbors, friends.
Welcome back to Doctors on Call. Tonight we're discussing mental health. Cary Schwarz has worked for High Plains Mental Health Center for 23 years as an outpatient therapist and the last 6 years as a senior outpatient clinical supervisor. Her special areas of clinical focus include cognitive behavioral and mindfulness therapies with a focus on trauma-informed treatment. Beth Christianson has worked for High Plains Mental Health Center for 15 years as an outpatient therapist and currently serves as a senior outpatient clinical supervisor at the Osborne branch office. Beth's clinical focus includes working with families and children. Beth is also a licensed clinical addiction counselor. Give us a call at 800-337-4788 toll free with your medical questions about mental health on Doctors on Call. Our show brings you information which may be useful to you when you visit your own physician or therapist. Thank you both so much for joining us tonight. We got lots of stuff we can cover. First of all, let's first talk about the fact we were talking in the intro that mental health care is health care. Let's talk about that.
Sure. And I feel like that is a very important distinction. You know, a lot of people tend to separate physical, mental, spiritual kind of health. And we really like it when people start recognizing that there's a significant connection between those two. You know, we know that sometimes kids and adults will have physical symptoms when they're having distress, whether that be depression or anxiety or something else. So just being able to be aware that physical health can sometimes signal that we also have some mental health issues that we can address.
Now, what mistakes, if any, do you feel that are being made in our healthcare system that might contribute to mental health worsening or declining?
I think there are several factors that could be considered. One of the things that obviously with this past year, the extra stressors that we've had with just changes in routine and across the board, we, I think, are doing a better job as a medical system. We have a lot of primary care physicians that refer to us because they can recognize that someone might be coming into their office first to look at the physical health symptoms, and after they've ruled out a lot of those medical physical concerns, they refer to us and say, I think something else might be going on. You maybe would benefit from someone at High Plains.
So you think it might be actually improving?
Yes, I think the awareness is improving. I think there are more assessments that are being done, whether that be in the primary care field. I think like OBGYN offices are doing a great job also, pediatrician offices. So yeah, it's getting better.
Excellent, that's great news. How would you describe your counseling style? We'll start with you, Beth.
I would, we kind of laugh at High Plains, like we spend a lot of time doing what the client needs. So depending on who comes into our offices, I work with a lot of families, so I prefer to have kind of a group setting for those family members to all come in so we can work together with the system to figure out what different strategies, different changes can be made in the family home setting to maybe make things work better. I work with a lot of kids, so we do some play therapy techniques. We do different types of art, and we also, with some of our teenagers and adults, use cognitive behavioral therapy. There's also dialectical behavior therapy, which I know Cary is well trained in with her work with adults, but we actually, as a team, are all getting trained in some of these new styles of therapy.
Yes. And what Beth said, I work a lot with the adults. I work with substance use clients, and I also work with marital, like the partner relational issues. So we really work on relationship, communications type skills, trying to understand, using a lot of empathy and understanding toward one another, and positive communication styles. Yeah.
What would you consider to be the leading causes of mental health issues today?
We've known that depression is the most common diagnosis for a long time. We also know that generalized anxiety disorder has been very significant and on the incline, and other types of anxiety disorders. So we've known about a lot of mental health issues for a long time. I think awareness has helped considerably. Being able to kind of watch for some of those telltale symptoms and signs has helped as well.
And I would say the science has gotten better at helping us recognize there's a lot of the biochemical piece of it. We recognize that there's family history sometimes. If we look back at family history, we do a good detailed assessment to find out, have you had great uncle or aunt or father or mother or grandparents that maybe struggled with some of these similar symptoms. We now know what to call it. They maybe didn't know what to call it at that point. So I think we're doing a better job of identifying it with the tools that we have and the science that we've gained over the last probably 10, 15 years.
Absolutely. What can we do as a society, do you feel, that to get over that stigma that reaching out for help isn't necessarily a sign of weakness, more so really of strength?
And I hope that the science part helps to understand that there are biochemical and other genetic factors that play in, certainly environmental as well. And I always tell clients that I get to talk to, I don't know very many people that I have met and actually gotten to know that if I hear their story long enough, kind of say, you would have benefited from talking to a professional at one time or another.
Yeah. It's to really more normalize some of the symptoms as well, to say, a lot of people have periods of time in their lives when they're stressed, or to normalize, for women that have just had newborns, like that's a period of adjustment. There's postpartum pieces that come with that, and to help normalize, I think that's helped with the stigma piece in the last few years as well.
Excellent. How does a person go about accessing mental health services?
Well, we certainly like it when they come to us. And the way that they do that is make that phone call. And our number that they can call, it's toll free, is 1-800-432-0333. And that will help you get to any of our offices. So we like it when people call in, even if they have questions. Is this something I could benefit from? We like it when we can talk them through that and help them decide.
Do you have access to like a 24/7 hotline?
We do. Part of our services that we offer is the 1-800 number that Cary just mentioned is available 24/7. So during the day, you will get our offices, and after hours, you will get a trained therapist that can assess what your needs would be at that time, figure out, if we need to call you the next day, if there needs to be a trained professional that meets with you right away because it's an emergency situation. So we do offer those pieces as well.
And a person doesn't have to already be a client of High Plains to use that hotline, is that correct?
That is correct.
Correct.
Excellent. Now, if a person knows that they need help but doesn't know where to start or who to reach out to, where's a good place to start?
And I think calling our phone number is a very good place to start, because you're going to be able to talk to somebody who is trained in being able to kind of direct where you need to go and see if you need to make an appointment and talk some more.
And if they're curious, I was going to, in addition to that, if they're curious, we have a website. It's hpmhc.com, and they can kind of look through our website about the different services we provide. If they're curious, some of our paperwork is on that website, so they can kind of look through some of the initial paperwork process, just to kind of get a feel for what would be asked in those first few appointments.
Sure. Now, do you guys offer a residential therapy for maybe those clients who aren't comfortable being in an office setting? Will you actually go to residences?
Well, we don't go to residences at this point in the outpatient part. We do have a part of our agency, a department, that reaches out to some of those that are even more struggling. They have more severe and persistent types of illnesses. So we can access those services. Most of the time, people would either access us in person or via telehealth. We are currently doing Zoom appointments and phone therapy. We also have branch offices, as you know, and outreach offices. So in almost all of the counties that we cover, we have at least one day a week somebody who is a trained therapist who goes to those locations and can see people. So for instance, I go to Rooks County Hospital one day a week, and I will see people there, and we do that in other health clinics and hospitals across Northwest Kansas.
Mm-hmm.
Excellent. And you mentioned the Zoom and phone. How do you feel the virtual therapy is going, especially this past year?
Mm-hmm. Well, we really started this around April, May when COVID hit, and we kind of say it's one of the good things that came out of the pandemic is for us to really provide more services, more access to services to people that would have normally had to drive 30, 45 minutes to get to one of our offices. And we've really seen some progress happening. I think we've gotten good feedback from people that they appreciate the availability of us being able to join into their homes. For kids, I think it's been kind of neat for them to say, hey, look at my room, look at my pets. This is a part of my life. I want to let you in on this, and it helps us kind of recognize there's some specific coping skills then that we can hone in on too, because we're a little bit more in their world than maybe when they're in our offices. So
excellent. That's wonderful. Well, we are talking about mental health this evening with Cary Schwarz and Beth Christianson from High Plains Mental Health Center, and we're going to go to the phones now. We've got Sarah on the line from Rush Center. Hi, Sarah. Go ahead with your question for our therapist tonight.
Hi, I am a teacher of young children, and I feel that sometimes we overuse the phrase children are resilient, and I was just kind of wanting to hear your feelings on that. I think even back to the mask mandate, like, oh, children are resilient. I can tell you my students never liked wearing the mask. They did it because they were told to do it. So just sometimes I feel like we just overuse that and wonder what your thoughts are on that.
Sure. Well, it's a good point. And yes, I think we have all said this year, if we can give our healthcare workers and our teachers a very long vacation, you have all certainly earned it. But yes, we talk a lot about resilience with trauma work. I think it's been a different kind of resilience this year with COVID because it's been a collective change for so many kids and for teachers and for parents to adjust to all of this. What we find, I think, is just being able to really hone in on what are some of the things we're really noticing in kids, because we may not notice it at first, right? You might have seen kids kind of struggle with it at first, and then they kind of, accepted that this is what was going to happen, but it wasn't necessarily what they were hoping to keep doing for a whole year. And so we kind of talked to families and individuals about the grief process, that this year really has been somewhat of a grief process. We went through that shock. We went through the is this really happening? We went through the denial, like this can't be really happening. Are we really not in school right now during spring break? And then going through some of that anger stage of this isn't fair. Why do we have to wear masks? This isn't fun. I don't want to stay indoors. I want to play football. So I think, yes, we need to validate for these kids that there's been a lot of things that changed this year. And we know from the research, when we're able to validate kids in their feelings and emotions and the things that they lost, we do see some resilience come back. But I agree, it's not just a term we can, just say, well, they're resilient, we'll be fine. It's going to take some work. And I would say even more so now, we're seeing a greater need for the mental health community to rally around kids right now, because there's just been a lot of changes this last year and they're having to process this grief.
Speaking of grief, you were kind of going through the different stages. How important is it to for a person to get through all those stages, or what might they be?
And I love that question. You know, what I like to tell people is it's not this linear process. You know, it's not I go from one stage to the next to the next. You know, it can be very mixed. It can be more than one kind of sense. You know, you can be in denial and anger at the same time at different points in trying to accept something. So, you know, I think that people need to work through that, and I think sometimes it does help to talk to people who are trained to say, we understand this, and you are doing something that is normal. You are doing a process that is good, and you know you will get through this.
Now, Beth, you had mentioned earlier about the play therapy techniques. That kind of goes along with Sarah's question. She said she was a teacher of young children. Sure. Describe what the play therapy techniques are.
Sure. Well, you have different variations of play therapy. You have some people that are registered play therapists. There's a group in the state that does that. At High Plains, we don't have really anybody that specifically does only play therapy because we see such a variety of ages. But a lot of times we know that play is the language that kids use to express a lot of their emotions. And so if we can use some techniques like having them set up, I do what's called non-directive play therapy. So you kind of let them set up the play therapy scene that they want, different characters, whatever, and then you work on just validating their emotions, which is kind of speaks back to what I was talking about earlier with resilience, is if we can just help them identify their emotions and work through those, then kids tend to do better.
And what do you find are some of the mental health challenges that are specific to rural Kansas?
Right. We have a process at High Plains, or a current interest, I should say, in really reaching out to people in the ag areas, because we know that those have been particularly hit. So we like to reach out. We have people who go out and do prevention education type seminars. We have several people who are trained in what's called mental health first aid that reaches out to communities, different agencies, people who are interested and ask for that kind of information, and it gives some steps that you can take to be aware. You know, what are those signs that we are going to be watching for? Give them some hope. You know, here are some resources that you can tap into, that kind of thing.
And at what point do you find that a patient might need to consider prescription drugs?
We certainly, in the assessment process, so when someone would first reach out, they come into our offices for that first initial assessment appointment, and we talk to them then about the severity of their symptoms. We do some assessment tools that help us identify how significant is their depression or anxiety. And we also ask them, with family history, has anybody else in your family benefited from psychotropic medications? And you know, with kind of all that information, we kind of assess, would it be good for you to see one of our psychiatrists? We have we have some on staff in person, and we also have the new telehealth providers. So that's been really great to get people in sooner than we had before. So people don't have to wait as long to talk with one of the doctors and say, here are my symptoms, here's what's going on, would I benefit from this? And so we help clients just guide them into recognizing that the research shows therapy and medications together typically has the best outcome for severe symptoms and moderate symptoms even.
Now, do you find that some clients come in and think that's going to be the cure-all, just getting on some kind of drug, and that's going to help them just get through what they need to get through?
And I think it would be lovely if it were that simple. I think most of us would like to be able to go to our doctor and say, okay, one thing, I just want one thing that's going to make me completely better. And what we do is we just kind of talk them through that and give them some expectations, hopefully, that are going to help them go through the process of it.
Sure. Now, when a patient is seeking out mental health therapy, what do you consider to be the most important traits to look for in a therapist that will work for them?
Well, we talk about building rapport. That is one of the research areas that has been just consistent over many, many decades, that if you can build that relationship with your therapist and other providers as well, you know, that's going to be a good outcome more than not. So feeling comfortable, feeling heard, feeling understood, somebody who's taking the time to really talk to you and try to get a good understanding.
And we recognize that, of our 25, 30 staff members, we all have different styles. We all approach therapy, with similar training, but we have different styles. And so I think it's important for clients to realize we will not be offended or disappointed if you decide, Beth, you're not the best fit for me. And I can say, well, then let's have you see Cary. I think Cary would be a better fit. We're going to really encourage you to see somebody that you feel like is a good fit. So within that first 2 or 3 sessions, we really say to clients, how are things going? Is this a good fit? Do we need to look at
And can
something different?
sometimes you on your end see that from your perspective that this person would be a much better fit for you? Absolutely. Walk us through a therapy session and what a patient can expect with you, Cary.
So if it's a first session, it's going to be a lot of just me asking questions, really listening and not trying to understand. And we really try to also build a lot of hope in that first and subsequent sessions, just kind of looking for what those strengths are that person brings, looking for the resources that they have, and also looking for some of those vulnerabilities and those areas that we're going to really hopefully get in there and help with. So a lot of talking, a lot of asking questions, a lot of clarifying, making sure we're getting it, and then the building hope, and eventually starting to kind of say, I think I have a technique that I'd like to show you. Let's take a look at this together.
What about you, Beth?
I would, very similar with Cary. I think there's some setting up, just helping them understand that this is a process. This isn't a 1 or 2. Some people will come in and just more of a consultation, but for most people, we say at least 6 to 8 sessions. Give it a try. Let's see how this goes. But yes, talking through, what would make life look better? Do you remember a time where life was how you would like it to be? How do we get back there? Let's talk about the things that work well for you. How do we help you sleep better? How do we help you get some exercise, nutrition? Some of the basics that I think we all forget to do sometimes in the busyness of our worlds. And so just talking about, a plan for in the next 6 to 8 sessions that I meet with you, what would you like to see happen? How can we make things better?
Excellent. What advice do you have for family members who are trying to help a loved one go through mental health issues?
Oh goodness, right. And that's where it gets tough, is if you have a family member who is seeing somebody else just really struggling and that person isn't quite ready. I would say, get on our website, take a look around at that. If you want, give a call, just kind of talk through what does this look like, possibly go ahead and set up, the assessment appointment and then get the referral and just see if we can get you in there and kind of understand what would be helpful to you and get you on that road to recovery.
And when might a person need to seek a professional to help them?
Say we encourage people to really kind of assess for themselves, is my sleep off, is my appetite off, is my mood off, is something different? Are things that used to not bother me bothering me? Am I worried about things that I didn't used to worry about as much, or I'm having a hard time controlling that worry? And when they get to that point, it's really kind of saying, hey, if we can intervene now, this is better than if we wait 6 months, a year down the road. Like the sooner the intervention. And we like to say, let's be preventative instead of having to be reactive to something that's happened. So if you just, if somebody else has said to you, hey, I'm kind of worried about you, why don't we go together? Let's call High Plains together and see what they have. We've got, our website, we've got the 7 cups that we partnered with some of the local ministerial organizations to provide that. We call it the Pinterest for mental health. And so people can go online, do some assessments there. Just, do some education, do some reading about some of these things, and then call us. Don't rely just on Dr. Google to tell you what you have.
Absolutely. How can a person recognize that they may be struggling with an addiction?
Ah, right. And I think, sometimes that's hard for people to recognize themselves. So sometimes relying on family members. I think just what she said, if it's starting to affect your sleep, if it's starting to affect your ability to wake up in the morning, if it's starting to affect your ability to certainly remember things, get to work on time or school on time, those are going to be some real markers in your mind that maybe I need to talk to someone about that. But certainly if you're engaging in any kind of risky behaviors, if your judgment about, oh, I can, drive with just one beer or one drink, that to me would be a red flag that you would want to tune into and say, that's not good judgment. That's me just starting to slip.
And what should family or friends do if they suspect a serious addiction problem?
Definitely reach out. I know that family members have said to us, I've tried to tell them I'm concerned about them and they are not listening. Is part of the addictions process is that denial. It's not that bad. I can drive with one beer. It's okay. And so really encouraging family members to say, no, we need to, we want to take you to go talk to somebody. We want to help you reach out to, some local groups, some counselors that can help you figure out, we don't want this to go down that road further.
That early prevention piece and treatment. Yeah.
Well, thank you both so much for being our guests tonight. That's Cary Schwarz and Beth Christianson from High Plains Mental Health Center. Thank you for joining us. For Doctors on Call, I'm Jenna Miller.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from At Blue Cross Blue Shield of Kansas. We're committed to being a healthcare partner you can turn to. That's why we're simplifying the health insurance experience so you can feel more empowered in your health.
Russell Regional Hospital, experts, neighbors, friends.